Massachusetts University, and I would be presenting on a semi-opioid nalbuphine-based pharmaceutical approaches, basically for the management of a severe pain. So this work was done in collaboration with the Defense Research Organization. And one of the issues is the traumatic injury, which is the leading cause of a death and morbidity worldwide among the individuals, especially above the 45 years of age. And these injuries are due to the shoot, warfield situations, motor vehicle accidents, maybe homicides, and injury which is also purposely inflicted by the another person. So as we all know that the pain is defined by the International Association, and it's a very unpleasant sensory and emotional experience which is associated with the actual or a potential tissue damage. So pain, if we define, it could be either a acute pain or it could be a chronic pain. So acute pain is the recent onset and probable, of the limited durations, while the chronic pain could be a neuropathic pain, which could be due to the pathological lesions or a dysfunctions or a peripheral nervous systems, or due to the physiological pain, which could be a non-traumatic, which discomfort, which is for the very short time. So our basic purpose or motivation to do the study is to find out something which is an ideal pre-hospital analgesic agents. And as I mentioned to you, this work was done with the uh, defense in together. So most of the cases we have found that, they would be using a morphine or opioids. So we're looking for treatment options for the pain, shock, and death. And the treatment options, as I mentioned to you, is been available is a hydromorphone and fentanyl, but we choose to have a choose the nalbuphine, which is this drug is a kappa agonist and mu antagonist, and it is effective in producing analgesic actions with the no respiratory depression or any other kind of adverse effects, which is generally encountered with the morphine and its analog. And the work we focused is on the several routes, but especially on the nasal, submental, and the pulmonary devices, basically to deliver the drug effectively for the pain management with a negligible side effect. So the objective was to make simple to use, safe, effective, rapid onset, and self-administrations, and effect should last for 5 to 6 hours, and also efficacy against the second-degree burns and also the fracture. So this is a slide showing the nanoformulations, which was prepared using anti-solvent evaporation method, where the peak position of a nanocyte samples, they were identical with those of the micronized nalbuphine hydrochloride. This implies that the nano precipitations had no effect on the structural properties. And furthermore, the peaks of nanocyte nalbuphine also has a lower intensity than those of the micronized. And when checked by this, the Malvern sizes, the nalbuphine nanoparticles is in the range of particle size is 336 nanometers. And looking at the cell toxicity at the dose of 1000 microgram per liter, the formulation was found to be very safe on the lung cell lines on the A549, which has been used. Then the comparison we've done with the micronized nalbuphine molecule with the nanoparticles for inhalations, and you can see that when it's compared with the micronized nalbuphine hydrochloride, the nanoform had a deeper penetrations and it reaches more, as well as the considerable improvement in the respirable portions, which has been seen. And this is the pictures of the initiation port and the pre-separator and various through the Anderson cascade impactor. And then the histopathology which has been done, this was a significant anatomical changes which is found in the lung tissue after performing the histopathology in the groups. And the the nano formulations, like first reaches is into the stomach and first relatively, and so the significant amount has been swallowed, and the maximum amount which is reflected in the stage, which we could see through the radioisotope tagged formulations after the minutes of the delivery. And thereafter, the counts in the lungs, they gradually decreased, indicating the formulations removal is from the lungs, into the blood. The gamma scintigraphy, which has been done in the rabbit lungs. So after inhaling a nano-sized aerosols of a radio-labeled nalbuphine hydrochloride, a gamma camera, captured on the first image of the rabbit lung, there was a deposition of a radio-labeled nalbuphine hydrochloride formulations in the lung within the 5 minutes of administrations. And the drug cleared out from the lungs of the rabbit after the 60 minutes post-administrations. To basically deliver the right amount of medications to the lungs via the inhalation method, there is a deep inhalations which has been required. So through the radio labeling, we had seen the radio labeling efficiency, the serum stability, also done the percentage binding of a radio-labeled nalbuphine hydrochloride and the transchelation of the radio-labeled nalbuphine hydrochloride. And herein, you can see through the dry powder inhalers, the basically, so in additions like the scintigraphy study, which is focused on its percent deposition in the lungs, sorry for it, and time required for systemic availability of the drug through the absorption from the lungs. So nano-nalbuphine was developed with a characteristics which favors the deeper penetration and absorption in the systemic circulations through the lungs and significant improvement in the respirable fractions. So this is the drug distribution after the inhalation. This is for the nanonized formulation, and this is the drug retention in a lung after the inhalations. So you could see the lung through the gamma scintigraphy, the nano-nalbuphine and the DPIs.
I'm sorry for interruption. If you need a few moments to have water or something, we can pause and give you more time.
Okay. Thank you.
Thank you. Please
so another formulations, which we prepared is the solid lipid nanoparticles. That is basically for the sustained delivery of a nalbuphine through the intranasal route. And this is to also manage the pain. In this, the formulation was basically designed through the factorial designs and statistical design, taking the box-Mencken design for an optimization tool for the formulations to study the effect of independent variables like lipid concentration, surface concentration, and the sonication time. And the dependent variables were the particle size and the entrapment efficiency. So you could see there's the variable factors and also the dependent variables which had been seen. And once, through these plots, the optimum, the formulations, which again has been tested through the FTIR. And if you see, there is no interaction which is found between the lipid and the drug interaction, and there is no extra peak which has been developed. So this is FTIR on the pure drug, and this is with the, the lipid using the solid lipid nanoparticles. Then taking the same formulations for the particle size distributions, the zeta potential was 22.47. And through SEM, we could find out the entrapment efficiency, which was also 92.89. And the loading capacity was 26.67. And also the, through DSE, it has been confirmed. And the in vitro drug permeation up to the 8 hours is also being done to say that there is a there is, the action which is sustained for 5 to 6 hours. And this also is been seen through the confocal microscopy. And the confocal microscopy was conducted on the goat nasal mucosa. And as illustrated in the figure, the nalbuphine loaded solid lipid nanoparticles showed permeations at the depth of 20 millimeters, whereas in case of drug solution, the permeation was at the 5 millimeters. And looking into the cell toxicity through the flow cytometry, there is a response latencies of the done on the rats after the intranasal administrations of nalbuphine solid lipid nanoparticles, and also compared it with the intramuscular route using the Eddy's hot plate, wherein the animal head is marked and also on the animal marked on the body. So animal marked on a tail, and data was represented as an individual response and latencies of this thing. So you could see that the thermal this thing and the efficacy of the formulation was performed on this Eddy hot place, and it was observed that the formulations showed the effect for the 8 hours, and the maximum effect was, seen basically at the 60 minutes. And while doing the histopathology of the brain tissue, there was no significant changes in the biochemistry and the hematological parameters of animal blood. All values were found to be in normal range and in correlations with the control. And in case of histopathology of the brain, all the neurons, glial cells, they were found to be intact at the 3x dose. These were the graphs showing the biochemistry parameters and the hematological parameters of the control saline and the dose at the X level and dose at the 3x level. And then also sees the effect of pH, temperature, and incubation time on the radio level complex for basically the stabilizations and the optimizations of the formulations. The biodistribution studies of the nalbuphine solid lipid nanoparticles was also done using the radiometry, and within the 10 minutes post the administrations, the prepared formulations, which is given through the intranasal route, showed the deposition of a drug in the brain, which lasted for 8 hours, and the maximum concentration we could see at the 2 hours. And the scintigraphy studies, which has also been carried on the Sprague-Rowley, the rats, and the pictorial representations through the gamma scintigraphy shows the nanotag formulations and its distributions. And you can see the image in 10 minutes, the deposition of a drug in the head region, and the deposition lasts for 8 hours at the target sites, showing the sustained delivery of the developed formulations. There was, I also tried the novel submental route for the delivery of nalbuphine, which was, done for the first time in ameliorating the acute pain in the pre-hospital emergent situation. So this was done that, sometimes, when they are in a war field, they need a immediate, pain relieving, while, there is no other alternative. So this could be, done by the soldiers themselves or by their buddies. So there was, the optimization of the injection volume, which was being done. And this is a pictorial demonstrations of a submental delivery, which was done in a rat. The volume which was injected was the 50 microliter, 100, 150 till the, 200. And, this graph shows the in vitro release, which has been, labeled with the technetiums, the DTPA with the nalbuphine, and, seen it through the estimation of a NLB, and it was the release for the tagging, which was done of the technetiums and the DTPA. So with the time and drug release, could find that the drug has been released up to the 110 minutes or 2 hours. By doing the histopathology of a submental tissue, this shows the image of, the muscle fibers and the inflammatory infiltrate. So there is, no change which has been found out into there. And again, this shows the normal structures with a tissue which is lined by the stratified squamous epithelial, except acute the inflammatory infiltrate and edema, which is underlining the tissue fiber, which has been seen. Again, following the eddy plates, hot plate. So this, as the marking with the, again, into the control and using the submental route and intramuscular route. So you could see that there is a response or the control with the 10 minutes, 30 and 60 minutes. It could be, seen through it. And then you just looking into the gamma scintigraphy, again followed up in a rabbit, there is a graph plotted between the percentage of the drug and the blood versus time in a minutes through the IM and SM route in the 6 experimental rabbits. And analysis were carried out using the, the P versions of the softwares. And you can see that the percentage of a drug after the IM injection, which can be seen over here, and the percentage drug after the submental. So in a submental, you could see that it's an immediate the drug which is been there. The average clearance of a technetium's nalbuphine from the site of injection post sub-administrations also, you could see through the through this graph. So this graph is plotted between the percentage of a drug gram of blood versus there in a minute through the intramuscular and the submental route in the rabbits. looking into this, the gamma scintigraphy, there is a comparative between the SM and the LM routes in the healthy human volunteers, which shows the comparative average clearance of technetium NLB from the site of the injections post the, submental and the intramuscular injections. And this analysis of a scintigraphy image were carried out using again this ESOFT, and the proof of concept crossover study was performed in total of the 3 healthy volunteers, which depicts the dynamic image in 30 minutes. And it's evident from the graph that 50% of a clearance from the submental, takes approximately 5 minutes, while 50% of a clearance, takes approximately 10 minutes. So similarly, 80% of a clearance from the site up to the submental takes, 11 to 12 months. From that, the IM, it takes approximately like 25 to 26 minutes. So in conclusions, there was earlier attempt at the systemic delivery of opioids through the lungs, utilizing the conventional delivery systems, and then there is the efficiency of a deep lung delivery. So thus pulmonary bioavailability for drugs such as morphine and fentanyl, developed nanoparticles which could deliver efficiently through the pulmonary delivery systems when designed for that. The conclusively showed that the developed nanoparticles of nalbuphine are rapidly, completely, and reproducibly available. And looking into the lipid-based formulations, it could be a promising nanocarriers for a sustained delivery of a selected uh, drugs or an nalbuphine with a biocompatible lipid property, which could, through intranasal route could be an alternative management. The submental route of nalbuphine is faster, more efficacious than the intramuscular route. Then in the emergent situations or scenarios, IM or IM route is compromised, there where the immediate, is been necessary, this, route can be followed. So the result obtained basically, in all these 3 indicates that all the routes like for immediate delivery, you can have a submental route, and then for a moderate pain, the intranasal delivery route can also serve a purpose as a non-invasive body care and shall be more useful in management of a pain, especially in the battlefield conditions. And the developed formulations and the intranasal routes opens new avenues in the management of pain, as do the submental route and pulmonary route for the delivery of nalbuphine to the patients which is suffering from acute pain like explosions or a bullet or a burn or a fracture injury for the faster actions. And, these are the strategies which are being used, post this research into the, the pre-hospital zones before, the patient reaches to the hospital scenario. With this, I conclude my sessions, and thank you very much for patient listenings, and it's open for any questions if you have any.
Thank you so much. It was a nice presentation, very, very visually